Next scenario, the poor access, the one we've been spending some time on, and this is really the area that it's most effective, for me, is these short clinical crown scenarios and just really difficult area to reach. It's hard to get 8 things back there to solve it. And when I can get my ring and sectional matrix back there, I do, and I get it done. But sometimes you find it very difficult to do. So this is a patient, and I took this picture and I left the cheek in here and everything on purpose, because I feel like a lot of times we see these images and we don't get a true perception of how difficult the case was, right? Like the images can make it seem like we had more access than we did, and that, I had a mile to work with. This was me struggling to get, I took this picture probably like 7 different times to get one image. And so I was working in an extremely tight environment back here, and the patient's masseter muscle and cheek muscles and cheek tissue was just like collapsing in on me. And I'm not a huge rubber dam guy. And even if you were, then yeah, you wouldn't have the cheek in your way, but you still have limited opening. And so the patient also had a hard time staying open. And so I would have to go in and out in spurts. And when these cases get tight, placement of matrix systems back here gets a little tough, and we don't have much height to work with. And so that's where things get clumsy, and we need something to just kind of bail us out. And so this is a good example of me actually placing the system from the palatal. So if you look here, you can see the preparation's done, Vitribond laid down, etched everything. And I like to do all my etching before I place my matrix bands in. And the reason is I don't like to put any liquid in after I place my matrix band. So I try to keep the area completely dry. So I'll etch everything before, rinse it off, dry it off, and then place my matrix band. And so we did it from the palatal in this particular case. 2 reasons. 1, I didn't have a ton of access from the buccal. 2, I had the easiest path of insertion from the palatal. It was like a slam dunk. And so you can use it from either direction. Place the system here, burnished and restored. And you could see the gingival margin, seal here. So it's kind of checking off all the important boxes for us, right? Gingival margin seal all the way through, matrix bands covering the buccal and lingual aspects of the box. That's all we need. We don't need a matrix band that goes all the way around the tooth. It's okay. We just need it right here, right? This is our working environment. And so placed in there, pop the restoration in, and the patient was on their way.